Now it's time to finish up our discussion of the appendicular muscles of the body by talking about the lower leg muscles. So here is a cross section through sort of the middle of the lower leg. And you can see we've got this huge posterior chamber here with the big calf muscles, and then some flexor muscles that are going to flex the toes. Then we've got this anterior compartment, much smaller in the lower leg. Here's the tibia here. These muscles are going to extend the toes, and then we have a couple of a lateral compartment that are going to plantar flex and evert the foot. So we're going to talk about all of these. All right, so the main muscle you need to know on the front of the leg is this tibialis anterior, and it runs just lateral to the tibia itself. If you've ever been kicked in the shin, you know it hurts so bad. And the reason it hurts is because there's no muscle between the skin and this bone. This bone is right up against the skin. There's just the subcutaneous layer between the skin and this bone, and so it just doesn't have as much protection as your other bones. The tibialis anterior runs just lateral to it, and then the tibialis anterior, it's going to be a dorsiflexor of the foot. So it's going to pull the foot up or flex the foot, what we think of flexing the foot. It runs beneath this extensor retinaculum, which is just like the extensor retinaculum in the wrist. It's going to protect these tendons from bowing out. The tibialis anterior inserts on the metatarsal of number 1 and the medial cuneiform bone. So it's also going to help to invert the foot or bring the plantar side of the foot medially. Now, the others of these anterior muscles, you just need to know the function of, and their functions are not quite as obvious as the ones in the arm, but we can figure them out. And honestly, there's so many other muscles I can ask you about. We've got fibularis muscles, which, as the name implies, run along the fibula down the lateral side. These are going to evert the sole of the foot. Okay, so bring the sole of the foot toward the lateral side of the body. Fibularis longus, fibularis brevis. And then we also have an extensor digitorum longus, which is going to extend the toes. Okay, so it's also going to help to dorsiflect the foot, but it's called an extensor because of the action it has on the toes. Okay, it's going to go all the way to the toes and help to extend the toes. We also have extensor hallucis, which is going to extend the hallux. And we have extensor hallucis longus and brevis. Okay. Now, fibularis tertius is going to dorsiflect and evert the foot. Fibularis longus and brevis evert the foot. These are going to run down the fibula. Okay. Now, the calf muscles you do need to know. So the main one, the superficial one, is the gastrocnemius. And it has two bellies, hence gastro, I guess, a lateral head and a medial head, and they make this little heart shape on the back of the calf. Okay, these originate actually on the condyles of the femur, on the back of the condyles, and so they help to bring the calf toward the femur. So they are knee flexors. And they also, because they, along with this other calf muscle, the soleus, insert on the calcaneal tendon or the Achilles tendon, which inserts on the calcaneus, they're going to be plantar flexors. So they have this dual motion of flexing the knee and plantar flexing the foot. So this is a very strong muscle on cyclists who spend all day bending the knee and pointing their toes. Okay, it's also really strong on dancers for that same reason, especially for pointing the toes. So gastrocnemius, two bellies, originate on the condyles of the femur and insert on this calcaneal tendon to the calcaneus, the calcaneal tendon, also called the Achilles tendon. Now, deep to the gastrocnemius is the soleus, which is shaped like the flatfish called the sole, right? Which is how its name came from. I don't know. It originates on the femur and the tibia, and inserts with the gastrocnemius on the calcaneal tendon and the calcaneus. So it's far more important as a plantar flexor of the foot at the ankle than as a knee flexor, but they work together to do the same thing. Now there's also a muscle called the plantaris, which plantar flexes the foot. Thank goodness that's what its name means. So here are those cut away, and some of the other muscles of the lower leg. We have the popliteus, which is this little muscle that goes across the lower leg and unlocks the knee by twisting the tibia in against the femur, and unlocks the femur from the menisci in the knee. So if you've locked your knees and then you need to bend your leg, that popliteus is going to contract, twist the tibia, and unlock your knee. And then we have tibialis posterior, which is a plantar flexor. And then we have other flexors. The flexus hallucis is going to flex the big toe. And some of the other flexor muscles to flex the other toes are also going to run down the back of the leg. Okay, now you do not need to know these muscles, but I want to show you this in the next diagram because I really want you to appreciate why you need to wear good shoes. Okay, I know this is another one of Professor Gould's rants, but here's the thing. You only get one set of feet and you need to stand on them your whole life. And if you don't take care of your feet by wearing good shoes with good padding, you are going to hurt your feet. The reason that your feet hurt so much when you've been standing all day, especially if you've been wearing shoes that don't have good padding, is because of all this shit on the bottom of your foot. Look at this. Okay, so this is the superficial layer. Here's your calcaneus. There's absolutely nothing between that and the ground except fat. Ew, right? That's why your heels hurt when you stand for so long. All right, we got a flexor digitorum. Just like in the hand, it's going to flex digits 2 through 5. We've got a flexor hallucis. We've got an abductor hallucis. We've got an abductor digiti minimi. The musculature here is the same as it is in the hand. Okay. Here's layer 2. We cut away that layer and we can see that we have a quadratus plantae that goes all the way across the bottom of the foot, helps to plantar flex the foot. We've got lumbricals just like in the hand. And then cut away that layer and we've got the flexor hallucis brevis, flexor digiti minimi brevis, just like in the hand. The big toe and the pinky toe have separate connections. We have adductor hallucis, which if this muscle is too tight, pulls the big toe toward digit number 2, creating a bunion. I don't know, who'd have thunk it? But wait, we're not done. There is another layer. Oh, there's the lumbricals. Then you have interossei, just like you have in your hand. So you have actually 5 layers of muscle in your feet. Layer 4 is the plantar interossei, and layer 5 is the dorsal interossei. Take care of your feet, people, because you have the reason your feet are so important is because you got to stand on them, and everything you do involves feet, and you have 5 layers of muscles that you're standing on. Take care of your feet. All right, so on our models, here's Mini Muscleman. You can see he's got the gastrocnemius, the lateral and the medial head, and you can see they split here at the popliteal fossa. Okay, there's really no muscle that goes across the back of your knee here. And then insert on the calcaneal tendon, and then this is the soleus that you can see deep to the gastrocnemius and deep to the Achilles tendon there on the lateral and the medial side. Okay, and then here you can see the tibialis anterior running just lateral to the tibia. This is the only ones you need. And we are done with the appendicular skeleton.